Good morning and welcome to another episode of Coffee and Tea with AARP, a biweekly conversation in which AARP staff and volunteers talk to Connecticut decision makers about policies and programs that are of interest to older residents. My name is Doroghazi and I'm one of the policy directors at AARP Connecticut. I'm very pleased to be joined today by one of our great AARP Connecticut volunteers from Southington, Lottie Prushinski. Lottie, could you tell us a little bit about yourself and your work as an AARP volunteer?
Good morning, Anna. There's really not too much to tell about myself, but I do have 3 wonderful children and 5 even more wonderful grandsons. Now with AARP, there are just so many great volunteer opportunities. I do volunteer in several areas. I do the advocacy, caregiving, road to livability, electric choice, and fraud watch. I am also an AARP Smart Driver volunteer, and yes, all the classes are virtual for now. But one of my most rewarding volunteer opportunities that I do outside of AARP is I am an at-home hospice volunteer, and that is very rewarding for me. And thanks, Anna, for inviting me today.
Great. Thank you so much, Lottie. We really appreciate you and all of our really tremendous AARP Connecticut volunteers who do so much of our work at the state capitol and out in the community. So thank you, and thanks for being with us. It is also my pleasure to introduce our special guest for today, State Representative Lucy Dathan. Representative Dathan has represented the 142nd District, which includes parts of New Canaan and Norwalk, since 2019. She's the vice chair of the legislature's Appropriations Committee and also serves as a member of the Human Services and the Insurance and Real Estate Committees. Before she arrived in New Canaan in 2015, she had a successful career in finance that took her all around the world to Poland, England, California. And since moving to Connecticut, she's continued to work with technology startups while also serving as a legislator and raising her family. So quite the introduction, Representative Dathan. It's really a pleasure to have you with us today.
Well, thank you so much, Anna, for hosting me today and the lovely introduction. And thank you both for all you do for the advocacy on the behalf of the residents in our state. Lottie, it's so nice to hear about your background in working with hospice. That is something that's really important to me. But your work is so important and really improves the lives of so many people. And I love my job as a legislator. I love representing people in my district, and I thoroughly enjoy bringing my finance experience as a CFO to the Appropriations Committee and rolling up my sleeves on our state budget.
Great.
Well, thank you so much for joining us today, Representative Dathan. To get started with today's conversation, could you please tell us a bit about what led you to run for office and what you enjoy most about being one of our wonderful state of Connecticut representatives?
Thank you so much. That's a great question. And there's several reasons why I chose to run. There was things that are going on at the federal level that were unsettling to me, and that was certainly a motivator. But probably the key reason for me was really the underrepresentation of women in our General Assembly here in Connecticut. In 2018, the year I ran, only 20% of the CGA were women. And my feeling is we're 50% of the population. I decided that I need to put myself out there and run. We're not yet at 50, but we're about a third right now.
Great. And as a fellow woman in policy, I really, appreciate seeing more diversity in our representation. So you serve on 3 committees that AARP interacts with quite a bit. So we mentioned the Appropriations Committee, the Human Services Committee, and also the Insurance and Real Estate Committee. So for folks who might not be especially familiar with the Connecticut General Assembly and all the various legislative committees, could you tell us just a little bit about what these legislative committees do just in general and what some of the work of these 3 committees in particular looks like?
Absolutely. I am really happy with my committee assignments and enjoy it every single day that I work in them. Appropriations is probably the biggest committee. It's one of the money committees that's responsible for the spending side of our state budget. We allocate or appropriate money to school districts, municipalities, government agencies, nonprofits like AARP, and other organizations that ensure that our state operates efficiently and effectively. My second committee is Human Services, and this has cognizance over all matters relating to the Department of Social Services, including institutions under its purview, like the department, and also the Department of Aging and Disability Services. A lot of members of Human Services also sit on the MAPOC committee, which I'm chair of the Care Management Committee, which has a lot of, as I said, Human Services, Public Health Committee members, and we oversee the state's Medicaid program. And my third committee is the Insurance and Real Estate Committee, and we oversee all the creation of the laws that deal within the insurance and the real estate aspects of our state. I'm very passionate about ensuring that we can make healthcare truly affordable in our state, and this committee is really ahead of its time when we're looking at these issues. So I'm looking forward to my work in that in the next session.
Great. Yeah, we've done a lot of work with the insurance committee and in recent years around prescription drug pricing in particular. So more on that soon.
You definitely have a lot on your plate. Now, one of the pieces of legislation that you co-sponsored last year and that was raised in the Human Services Committee is an act concerning a state home health and hospice ombudsman. You also recently convened a work group to look into this issue in more detail. Could you tell us a bit about how you came to be interested in this issue, what a home health and hospice ombudsman would do, and why is this important for us?
That's a great question, Lottie, and thank you first for your advocacy in this area. It is so important to have volunteers like yourself that have the experience that really can support families. But this was brought to my attention by a constituent of mine who indicated that our state didn't have anyone that supported individuals and their families who came to choose to have home hospice care in their final days. It is, as you know, a difficult time for everyone involved. And with so many more people choosing this option and it continuing to grow, I decided that this was an important position and that's something that we needed to invest in for our state so that all families would be able to ensure that the rights were maintained. And I was so pleased that we had so many participants involved. We really, in the 2021 session, we didn't get to where we needed to go to get this legislation over the finish line. And working with my Human Services Chair, Kathy Abercrombie, she said, let's look at it in a work group in an off-session timeframe and get people who are involved in this area and that have really want to make sure that we're doing the right thing and we're addressing all the issues. And I was so pleased that so many people stepped forward and so many participants were involved in this work group. And particularly, I'm so grateful to AARP's involvement and the support of this process. During this time frame, we've met since August. We've met about 4 or 5 times. We've worked on developing the legislation, looking at the pros and the cons, and really looking at how to make sure that we are successful and considering some of the things that we didn't even talk about in the initial 2021 proposed bill. And I think this work group and AARP's involvement and their suggestions from people around the state will make this a better, more sound proposal, and it will be successful in the 2022 session. So I'm currently working on this piece of legislation now and looking forward to submitting this bill in February as the CGA reconvenes for the 2022 session.
Great. And for folks who aren't familiar with the idea of an ombudsman generally, you should maybe mention that Connecticut currently has a long-term care ombudsman program that's focused on nursing home residents and folks who receive care in more institutional settings. And I always put out their number because I just love the program and their services. For folks who are in those settings and need the advocacy and assistance of the Ombudsman program, their number is 1-866-388-1888. And one of the important things that we were discussing in this work group, as you mentioned, Representative Dathan, is, in recent years, so many services have shifted away from nursing homes and into more home and community-based settings. AARP has an interest in making sure that people receive their long-term care services wherever it makes sense for them, and to really empower people to make those choices for themselves. So as we've shifted to serving more people in the community, which upwards of 80% of folks say is where they want to receive those services. We just want to make sure that they have access to services like the Ombudsman program that have typically been, more focused on facilities. So I think it's, AARP was really excited to participate in these conversations as part of the work group. And I know I learned a lot and am looking forward to looking at this issue again during the 2022 session. So
Yeah.
Thank you.
And can I just plug in something here that
Yeah,
I
of course. Yeah.
I know we love to talk about advocacy, and I would encourage your members, if this is something that's important to them, to really speak out as part of the legislative process. And when it does come to a public hearing, hopefully sometime in March, that people submit their testimony on why this is important, maybe even anecdotally why this would have helped them or their families in this state. So I think it's so important that we hear from so many people so that we can do quality legislation.
Yeah, wonderful. Thank you for mentioning that. And I think I want to circle back to that idea in a minute, just because I think that, that constituent involvement is so just fundamental to how AARP tries to approach our work. But before we, move too far off the topic of hospice, Lottie, I know you mentioned when you introduced yourself that in addition to being an AARP Connecticut volunteer, you also volunteer with a hospice at home program. So could you speak a little bit more about that and just speak maybe generally to what should people know about hospice? What is it? What do people, understand or not understand? And what has your experience with that been?
Well, Anna, a lot of people believe hospice care is very short term. I have visited hospice patients for over a year sometimes, and as a volunteer, you develop a real connection with the patient, the family, and the caregivers. And as a hospice volunteer, I try to help provide patients and family with compassionate care and support during the entire hospice process. I learn a lot talking with the patients and the caregivers, sometimes reminiscing with the patients and the caregivers, talking about changes in the community, sometimes talking about things we did when we were younger and we really don't want to discuss with anybody else. So it's very, very rewarding for me. But what's really important is for the caregivers to have some time for themselves. Think about this, to run errands, to do grocery shopping, even to go to their own doctor's appointments, things we take for granted if we're not caring for a loved one. So for me, it's just very rewarding and I truly enjoy it.
Wonderful. And as always, I thank you so much for everything you do, both for AARP and then, through this volunteer work that you do as well. And Representative Dathan, back to you. We've touched on, your interest in bringing forward a bill related to, hospice and expanded community ombudsman services. But what are some of the other top issues that you expect you and your colleagues to work on during the 2022 legislative session? Are there issues that are particularly relevant and important right now to your caucus or to you as an individual?
There's a lot of interest in a lot of different areas. I think, when I start thinking about other things that are important, is really looking at some of the areas that COVID's taken a toll in our state. And I think the thing that kind of comes to mind for most folks is mental health issues. And And it's not just, with our school age kids or our older residents, it's every generation. And we really need to make sure that we address that. I've told about my mother's story before. My mother suffered from Alzheimer's, and the pandemic and the isolation, even though she was in a nursing care facility, was really too much. Her nursing care facility did an amazing job keeping her safe. She never contracted COVID. But the toll on that was my mother was secluded in her room. And here was a woman who was, bright as a button when it came to interacting with people, engaging with people. She loved all the social events that her home did, and the isolation really took a toll, and unfortunately took a toll fast, and she died in May 2020. And I know I'm not the only person that can say that this happened to them. And I think we have an opportunity as a state to ensure that folks, especially our aging community, are able to access resources to help with their mental health needs so that we don't have this issue going forward. So that is something that's probably the biggest thing that I will see in various committees, not just within the appropriation side, but I'm sure we will be looking at that in human services as well.
I agree. I agree with you with that. So thank you so much. But I have a question for you. So 2019 was your first year as a legislator, and that was really, I guess you could call it the only normal legislative session you experienced before COVID-19 and the disruption that it caused all of us. So what has it been like to be a relatively new legislator during a pandemic? And along the same line, do you have any sense of how the pandemic will impact the upcoming legislative session, which is going to start shortly?
Yeah, well, 2019 was a whirlwind. It was like drinking from a fire hose, and learning so much and being in the Capitol 5 days a week, attending as many events and meetings as possible, really just to learn as much as I could. 2020 session started up normally, and then we had the closer in mid-March, as you pointed out, and not a lot happened. Well, in 2021, many of us were so committed to making sure that we could have a safe virtual session. And I had some doubts that we were going to be able to get as much stuff done as we did in 2019, but I was really wrong, and was really pleased. We all worked incredibly hard with multiple committee meetings happening simultaneously, lengthy public hearings. But I think most of all, what impressed me the most was our public's involvement. And it was so wonderful to see, that opening up this virtual aspect really engaged our residents. Now people who wanted to have their say didn't have to take a day off work, leave their families, or who were physically unable to make the trip up to the Capitol. And these people were now able to be engaged either by Zoom or just submitting testimony as they may have done in the past, but having that virtual aspect to be able to have their story and have their few minutes. And I think it's made our legislation come out better as a result. I think in 2021, we improved the efficiency of our legislative process. We've engaged our residents, and I really honestly feel that 2021, it was a success. 2022 is, a different story. We have vaccines, we have boosters, but right now we, as everybody knows, our numbers are not going in the right direction. So there's a lot of debate on how this will work. Luckily, we're still about a month away. So we do have some time to see how our numbers go. And but many people are advocating for a virtual aspect so that folks can feel safe to participate and be involved in legislative process like they were in 2021. But it's still up for discussion how it will look in 22, which is opens the 9th of February.
Yeah, and some of my AARP colleagues have been referring to some of these aspects of the pandemic is the tarnished silver lining, that I think we learned a lot last year about, what was possible in terms of access to the legislature. And public hearing days can be so long. I mean, certainly for legislators, I know you all had some, 24-hour hearings last session. But, that ability for someone, in Stamford or somebody in Norwich to be able to, quickly ring up and speak for their 3 minutes and then go back to their lives instead of spending all day at the Capitol, really, it made a difference for a lot of people. So it'll be interesting to see what we hold on to. And
I fully agree. I mean,
yeah,
thinking about our older residents that really just don't have the ability to, hop in a car and drive up, however far it is to get to Hartford. We're a relatively small state, but, we have many folks that are challenged to be able to do that. So I'm really pleased. And I think our legislative process benefited from it.
Yeah. And we'll hopefully we keep all the best pieces moving forward and go back to some of what we miss.
So about it was I could actually just sit in my living room and watch everything that was going on, and get up when I needed to. So I really enjoyed the sessions that I did watch.
Yeah,
that's a great point, is you can follow along on CTN even if you don't have access to Wi-Fi and look at it on your computer. You can get it through your cable, and that's really beneficial as well. So
absolutely. And I do want to circle back to something that you were talking about earlier, which was the importance of, if there's an issue you care about, reaching out and really making your voice heard to your representatives. So AARP, nationwide, and then here in Connecticut, we have a big membership, nearly 600,000 here in Connecticut. And we always encourage our members to reach out to legislators, for any issue that's important to them, especially if it's an issue that AARP cares about as well. But as a legislator, can you speak just a little bit more to how that matters and why that matters? And, when people do reach out to you, are there more and less effective ways that they can communicate, support or opposition to something that you're working on?
So I think you raised some great points, Anna. I fully agree with you. I gave the example before about how I learned about this hospice ombudsman through one of my constituents who really raised the issue to me. But I'm also working on other proposals now that have come out of constituent ideas and discussions I've had, things in the insurance space, something in transportation, just to name two right now. I personally love hearing from people either by phone or by email. I know not everyone has access to email, so it is important. I've also loved to engage with people in person when our COVID numbers have been safe. I truly feel that I'm your advocate in the Capitol, and I think it's vital for me to know what's on your mind, even though maybe it's something that I agree with or something I don't agree with. But I feel like I need to know that so that I can represent you. And it is so important for me to understand what's important. I know a lot of folks who say, oh, well, I think Lucy already supports, X issue or Y issue. But hearing that via either an email, it can just be a simple one line, or it can be a phone call, just to say, this is something that's important to me. It kind of reaffirms that, things are important. As I said, email is great. My email is lucy.dathan@cga.ct.gov. You're welcome to reach out to me that way. You're welcome to reach out to my office phone number, 860-240-8585. We can speak directly. I do hold town halls. I've had coffee hours, again, when the numbers are in the right direction. But most importantly, I just need to hear what's going on. And I get a lot of emails every day, so sometimes it takes me a little longer than I would like to get back to you. but I read everything and want to make sure that, I'm your representative. So I think what I advocate for most is if there is some piece of legislation that is important to you, that you submit testimony, either written or in person or via Zoom, because that's how legislators also get to realize if there is maybe some aspect that was not considered when forming the legislation, because we all bring different experiences to the Capitol. Our constituents bring even other experiences that we don't necessarily have. So hearing from folks in the public is just vital to making sure that we do very thoughtful legislation. So I very much appreciate time and effort put in for that. And it doesn't have to be, your sophomore English essay. It can be, 2 or 3 lines why something is important to you. So it's more important to have the thought there than anything else.
Well, first of all, being an AARP advocacy volunteer, I really hope to meet you in person in the future when the legislative session will be open to the public. But before we wrap up our conversation, is there anything else that we haven't talked about today that you would like to discuss, or do you have any helpful resources to share? I know, thank you so much for sharing your email address and phone number, or maybe some recommendations for how people can keep themselves informed as the legislative session gets underway in a few weeks?
Well, the way I keep my constituents and anyone who wants to sign up for my list, even if you don't live within my district, is to sign up for my mailing list. I try not to inundate you with information, but I do email out at least once a week, kind of what's happening in the state. During the session times, I give a little bit more updates about what's happening in some of the various committees, what public hearings are coming up. So signing up for my mailing list, just emailing me and letting me know you'd like to be part of that and hear what's going on. There is also the CGA website, which is cga.ct.gov, is another resource to find out what's happening at the Capitol. I know everyone's thinking about COVID right now, either trying to figure out how to get a booster shot or to figure out how to get testing. 211 is a great resource for that, either by phone or on email. That is a great way to do that. But as I said, I like to have also sort of monthly sort of sessions or town halls or something, if you will. I am having one on January 26th. The date still to be confirmed, but that's the plan right now at 7:00. It's going to be via Zoom. The topic's going to be a budget roundtable. So we're really going to talk about what the sort of budget priorities are for the fiscal 22 session. Just to let folks know, it is a shorter session. So our part-time legislature operates either in about not quite a 6-month cycle or sort of about a 4-month cycle. And it alternates every other year. So this year is the shorter cycle, and we really focus in on budget items. And so this year, that's going to be one of the key focuses. And me as vice chair of appropriations, that is something that is pretty important to me. But I get, lots of ideas from folks, and the idea about having this budget roundtable is really a way that we can, I can hear people's ideas, talk about things that, what we're bouncing around at the Capitol, but really have that initial engagement and answer questions for people because it is so important. So thank you for those questions.
Yeah, well, and thank you so much for taking the time to speak with us today, for sharing all of this great information and letting folks know, first of all, that it's effective to engage with your elected officials, and then giving them, so many great ways to reach out to you in the coming weeks. Thank you also, Lottie, not just for co-hosting this conversation, but for all the great work that you do, both with AARP Connecticut and in your other work as a home hospice volunteer. If you're interested in learning more about AARP's legislative work or our upcoming events, please visit aarp.org/CT, or feel free to reach out to me directly at ADOROGHAZI, it's a long one, at aarp.org. Representative Dathan had mentioned public hearings and some of the other ways to engage. Always happy to speak to AARP members about how you can be more involved in those pieces of the legislative process. So thank you to everybody watching for joining us today. We hope you'll join us again in 2 weeks for our next episode of Coffee and Tea with AARP. And again, Lottie, thank you so much. And Representative Dathan, thank you so much for all you do and for being with us today.